There is a public health recommendation that exclusive breastfeeding should be done for the first 6 months of life, and this applies for usually, normal baby with a normal birth weight. But from 6 months, the needs in terms of energy, in terms of nutrients, are not sufficient. So food needs to be introduced in addition to breast milk from six months old.
Infants at that point will start taking tastes of foods and trying foods. Oftentimes infants at first, they're going to grimace the first time there's something on their tongue that they're not familiar with. But what we know is that if a mother or a caregiver continues to try 2 or 3 times, then the infant will accept the food. It's important around 6 months to start trying those foods and then gradually introducing more and more of those foods into the diet. And just like for adults, having a balance of a diversity of foods and vegetables and fruits and some starches. Animal source foods are particularly important because it's the best way to get iron and zinc and some other nutrients in a way that the body can absorb it.
We need to make sure also that the mother continue to breastfeed, because breast milk remains the most important kind of food, especially in that first year. So between the 6 months and 12 months, breast milk should always be fed first and followed by the foods, because it is in itself a great food to provide to the child, and continued until 2 years old or beyond. So the risk for a child, if they don't get the right food, is to become malnourished. This first 2 years of life in particular it's a very key period for growth, for development, and for thriving. And the adequate nutrition is absolutely essential for a child to be able to grow and develop adequately. So if the child doesn't receive enough nutrients with the food that is being given to him or her, he or she may become more malnourished, stunted in most of the case. Or if the food is not adequately prepared, a child also may become sick, may have more diarrhea. So the hygiene part is also very important. And if the child is being given unhealthy food, like those foods that are too sweet, too salty, too fat, there's a risk also over time for more disease like obesity.